to our other top story. The numbers are just staggering as COVID cases skyrocket across the U.S. The 7-day average in the U.S. now topping 260,000 new cases per day. That's a new high. Last week alone, there were 1.8 million new cases nationwide. But the president's top advisor, Dr. Fauci, also offered a dose of encouraging news today. While the Omicron variant appears to be highly contagious, hospitalizations are not yet rising as steeply as cases. He also pointed to new studies that suggest the variant seems less severe than Delta. Kerry Sanders has more from Miami.
Tonight, a disturbing 60% surge in daily COVID cases compared to last week. The hyper jump in numbers largely due to Omicron, according to the CDC.
It's hard right now. I hope people can do their part, get vaccinated.
Dr. Jeff Polov in Wisconsin says new COVID patients will likely spend the night in the ER because his hospital is at capacity.
Many of them will be unvaccinated. They'll have regrets. Some will even ask that they can be vaccinated tonight, but I'll have to let them know that it's too late.
Joining medical teams on the front lines, more than 13,000 National Guard troops deployed across 48 states.
I just want to make sure I'm safe.
Dr. Fauci says studies suggest Omicron is less severe than Delta. One out of South Africa showed fewer admissions to the ICU, fewer patients in need of supplemental oxygen, and shorter hospital stays for those infected with Omicron compared to other waves. Still, many are questioning why the CDC abruptly cut quarantine from 10 to 5 days. Those who work in close contact with the public worry they are now more likely to be exposed.
We have policies that are putting this pandemic on the backs of the frontline workers rather than supporting us.
In New York, 30% of the fire department's EMS is out sick today. This morning, the CDC's Dr. Rochelle Walensky defending the new guidelines.
We have seen relatively low rates of isolation for all of this pandemic. Some science has demonstrated less than a third of people are isolating when they need to. And so we really want to make sure that we had guidance that people were willing to adhere to.
She says that according to the CDC's most recent data, people are most infectious 1 to 2 days before symptoms appear and 2 to 3 days after. So these 5 days are when you'd be the most contagious. And according to the CDC, when up to 90% of COVID transmission occurs. 5 days after you test positive is when the CDC's new isolation rules would end if you're asymptomatic. Not only would symptoms have likely gone away by then, but the CDC says so too would the likelihood of transmitting the virus. Dr. Walensky was also pressed on why no test is required to confirm an all clear.
That antigen test was actually not authorized for this purpose. Its information would not be useful. Regardless of what the antigen test said, we would say you still need to wear your mask for 5 days.
Complicating things, the FDA now says those antigen home tests, which have been in short supply, are also less able to detect Omicron. Lauren Johnson recently took 4 of them after being exposed. They came back negative. Still, she got a PCR.
My PCR test was positive.
Your antigen tests are still a better option than nothing. They're just limited in their sensitivity. You can have what's called a false negative. That could give you a false sense of confidence.
And Kerry Sanders joins us now. Kerry, so many people use those at-home tests before gathering with friends and family over the holiday. And as you know, New Year's Eve is just 3 days away. So what do experts suggest now?
Well, medical experts say that you can still use the antigen test, but they caution against relying on it. And as we've heard, they've told folks that really you should not get into large groups, avoid gatherings like that. But if you do go out, they highly recommend that you wear a mask like this, an N94 and N95. And if you can't get your hands on one of these, they recommend using a mask like this, but doubling it up. Kristen?
Really great information. Kerry Sanders, thank you.